Namaste everyone. In my today's video, I'm going to talk about slip disc problem. Nowadays, many people are suffering with the slip disc or disc bulge or herniated disc problem. Do you know what is slip disc or herniated disc or disc bulge? As the name is only saying slip disc, when the disc slips from the vertebrae. So there are blocks of vertebrae. We have 33 vertebrae. In simple language you can understand, there are small box, 33 box, and between the two boxes there is a jelly kind of disc in between two boxes or in between two vertebrae, which gives a flexibility to our spine. And when we do prolonged sitting, we are sitting many hours at one place, our posture is bad, forward head, forward back all the time, sedentary lifestyle, lot of stress in day-to-day life, not eating on time, not sleeping on time, not doing regular practice of yoga or any kind of exercise, then certainly the slip disc problem will come. As we all know, our spine starts degenerating after the age of 30. So few years back, people used to get slip disc problem after 50s or 60s of the age. But nowadays, because we are into sedentary lifestyle and a lot of stress in day-to-day life, not eating on time, not sleeping on time, these all factors are giving this problem in early stage of the life. Like nowadays you see the slip disc in the age of 20s or 30s, and the only solution doctors are prescribing is surgery. So it is very difficult to have surgery in such a young age, and after surgery also there is no permanent release, because surgery will cut the disc which is slipping out from the two vertebrae, but the root cause is still there. The root cause is to change your lifestyle, to start doing some basic stretches where we try to stretch the spine on daily basis, and we create the space between the two vertebrae. So the slip disc, the disc which is slipping out, should go inside slowly at the particular place. This is one of the way we can work on the slip disc problem. So in this video, I'm going to give you few yoga stretches which you can do on daily basis, especially in the case of slip disc or disc degeneration. You can do these stretches. These are very safe stretches on daily basis. But in this video, I am going to tell you the sequence which you can practice every day at home. So let me show you which one is the first yoga stretch. So first yoga stretch I'm going to show you is Tadasana. So you just keep your leg together or little gap in the leg. You can do this asana with the help of the wall also. What you need to do, you need to interlock your fingers and slowly come on your toes, tip of the toes, and stretch your whole body, look forward, look straight at one point. Initially try to do this asana with the support of the wall. When you feel confident, you can do independently. So hold this by keeping a smile on your face. Keep your breathing normal. You will feel each and every vertebrae which is just coming to closer will come in the original shape if you practice this asana every day. So you can hold up to 30 seconds to 1 minute in this asana, and slowly bring your heels down and bring your arms down. After every asana you just do little relaxation like this. Then we move to our second asana. So second asana is also a form of Tadasana, which is we call it Triyak Tadasana or triangle Tadasana pose. So keep your leg little apart, probably hip width distance apart. Then interlock your fingers and stretch your arms like this, and slowly lean to the right side. Look forward. Close your eyes, keep your breathing normal. Minimum you hold in this position for 10 seconds. Maximum you can hold up to 30 seconds. Keep breathing normally. Then slowly come back to the center. Relax, take 2 deep breaths, and then you go to the left side and hold this position again with the smile. Keep breathing, do not hold your breath. Hold for 10 to 15 seconds. Minimum 10 seconds is necessary, up to 30 seconds you can hold. Slowly come back to the center, take 1 deep breath and exhale. Slowly release your arms. Relax your leg and relax your arm in Shithali Tadasana. This is also very important asana, Shithili Tadasana, where we cool down by keeping our body straight. After cooling down, I'm going to give you one more stretch for your lumbar spine. So you need to face forward, keep your leg apart or join, whatever way you feel comfortable. Then slowly keep your palms on your knees. You can bend your knees and try to make your back straight by looking up. Now if you see, my back is completely straight and I feel beautiful stretch on my lumbar or lower back. Close your eyes and take some deep breath, as if the breath you can feel in the spine. Try to breathe through your stretch. Keep breathing. You will feel a very nice stretch at the lumbar spine. This is also you hold 10 to 15 seconds or up to 30 seconds. So this is one way to hold this asana. Another way, you can keep your hands in front of you on the wall or on the chair and just give the same stretch. Make sure you keep your head up and looking up, and then slowly release the position. Next 3 stretches I'm going to tell you in the sitting position. So we need to sit. What you need to do, just bend both the leg and keeping one leg on other leg like this. We call it Kapotasana or pigeon pose variation, and try to just walk inside and hold this position for a while. Feel the beautiful stretch on the sciatic nerve. Hold this position 10 to 15 seconds with normal breathing. Now slowly walk your foot forward and release this stretch. Same way other side, you're going to keep the leg on other knee and hold, and try to walk your leg little inside so you have a nice stretch. Hold this position 10 to 15 seconds with normal breathing. Deep breathing through the stretch. Feel your stretch. Once you're done, release slowly and relax. Another stretch I'm going to tell you is Bhunaman Asana. It's very beautiful for your lumbar spine. So you breathe in the center. As you breathe out, you twist back. Don't go fully down. Keep your head up. Inhale, exhale, other side. Inhale center, exhale other side. 3. Inhale, exhale 4. Inhale, exhale 5. Inhale, exhale 6. Inhale, exhale 7. Inhale, exhale 8. You will feel very nice stretch on your lower back if you do it. And the 9th round you are going to hold for 5 to 10 seconds. Normal breathing. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Same way. Just hold 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Slowly come up. Relax. To release the heaviness from your leg, just keep your hands by the side and just move your knees in this way to lighten your leg and increase the circulation from your leg. Another way, one more tip I will give you to stretch your calf muscles, because calf muscles plays very important role in your sciatica pain. If you have a tight calf muscle, you will have lot of pain, even the hamstring muscle. So inhale, toes towards your face and feel the stretch on your calf. Exhale, forward. Inhale, up, hold 5 seconds. Exhale, forward. Inhale, inward. Exhale, forward. Inhale, inward, hold and relax. You can repeat 4 or 5 times more if you feel good. Then just separate your leg. One more stretch where you drop your toes inside and hold this position. This gives you instant relaxation from sciatica pain. Hold 1, 2, 3, 4, 5, release. Once again, hold 1, 2, 3, 4, 5, release. Once again, hold 1, 2, 3, 4, 5, release. So these are the stretches you can practice every day. Early morning, just spending 5 to 10 minutes will give you lot of relief entire day. So this is the one way. Another very effective way is acupressure therapy. As I have already posted a video, 5 minutes acupressure massage for sciatica pain, and many people got benefited with that video. So you can find this miraculous video here, instant relief in sciatica pain. And now for slip disc, you can do similar asana. You can do first yoga stretches in your daily routine. Second, you need to adopt the acupressure therapy, which is very effective and very miraculous. So in this video, I'm going to give you 3 acupressure points which can work wonders for your slip disc problem. So what are these points? On my hand, if you see, I have marked 3 points. So if you are a female, use your right hand. If you are a male, use your left hand. So I'm going to show you on the left hand. So you see between these 2 fingers, I have marked a point. This is the lumbar spine point. Most of the time, the slip disc area is lumbar spine only, which is from L1 to L5. So you will find this area here. So what you need to do first, you need to take some oil. I have taken some mustard oil in a glass jar and I have put some fenugreek seeds. So you can take 3 tablespoons of mustard oil and put 1 tablespoon of fenugreek seeds in this oil, and keep this oil ready always like this only, and just dip your thumb in this oil. Massage this point up and down, down and up like this. You need to massage minimum 2 minutes or maximum 5 minutes you can massage. And if you feel any pain here, suppose, just give a little press and loose, press and loose, press and loose, press and loose, because it depends in which vertebrae the slip disc is happening. So if it is L5 to L4, then you will find here. If it is L3, L2, L1, then you will find here. So you just need to simply massage this area, and if you find any painful point, just keep pressing that with press and loose method, not release. Release is this, just press and loose, press and loose, press and loose. Do this 50 to 60 times if you find the painful point, or just give general massage to this area 2 to 5 minutes. So after doing this massage, you reach to this point. So I'm going to show you the closer view. So it is exactly in the center, in the first finger, which is my index finger. So as I said, if you're a male, use your left hand. If you're a female, use your right hand. But if your problem is chronic and you want the instant relief, then use both the hands. So I'm taking this left hand, and this lower part I have marked a line. So in the center, you just take the oil, same oil in the thumb, and massage this area nicely. Same 2 to 5 minutes. And then after massaging 2 to 5 minutes, just do press and release method. Press, release, press, release, press, release, press, release. After doing this press and release method, just slowly release the thumb up. And now we are reaching to the third point. So which is here, the first joint of my index finger in the center. So this is a very micro point. So you need to just massage it nicely with the help of the oil. Same way 2 to 5 minutes, and then press and release, press and release, press and release. So whatever pain you are having, you will see the instant relief after massaging these 3 points. And if you have extra time, please do it in this hand also. If you do it in both the hands, then you will have instant relief. So after doing these 3 points massage, you will find instant relief. But slip disc is a little chronic problem. It takes time. So what you need to do, you just keep doing this therapy every day, minimum for 15 days, maximum for 3 months. If you do continuously for 3 months along with the yoga stretches, you will see the problem is getting cured from the root. So try this therapy, and along with this, I'm going to give you one rubbing therapy, which you do it on any time wherever you're sitting. If you're sitting on sofa, watching TV, sitting in the car, not driving, and your hands are free, you can do this rubbing therapy anytime for instant relief. So as I told you, in the index finger, the first joint in the center, I have marked a point. So in each finger we will find the point here, and I'm going to join these first joints of my each finger, and I'm going to rub it. And you need to do the rubbing with the smile, happy face, positive vibration, and you keep doing for minimum 2 minutes, and maximum you can do up to 5 minutes. You can practice this 2 to 3 times in a day whenever you get time. You will see miracle that your lower back health is improving day by day. So after doing these practices, I would suggest to add some deep breathing practices in your routine. Because if you practice deep breathing practices, it can manage your stress. Due to continuous stress, there is a cortisol hormone releasing in the body, which makes our muscles tight, which makes our movement restricted. And if cortisol hormone is there in the body for the long time, then there will be more chances of having slip disc. So along with yoga stretches, acupressure therapy, I would suggest to do some yoga breathing, some deep breathing practices. I have already posted a video, deep breathing practices, which is box breathing, which is very, very miraculous. So you can find this video here. You will see miraculously this slip disc problem is getting cured without getting into any surgery. So just do try these acupressure therapy. See the miracle that the slip disc problem or the pain which has reached to the stage of surgery has started reversing back. So do this therapy and let me know in the comment box if you're looking for any other video on any other topic. And also I have made some courses for you, which is 3 days acupressure therapy course, 3 days Mudra therapy course, 7 days face yoga therapy course. Many more courses are going to come, so you can find the link in the description. So that's it for now. Thank you everyone.